Okay, so next up we have Virginia, who's talking about mechanistic evidence for immunization programs. Thanks.
Okay, thank you. My presentation of today is just about one project I carried out with Public Health England for 6 months, starting in January this year. And I will just describe the project and the results of the project, and I would really love to have feedback on the results. And then I will propose also some take-home messages about the collaboration with Public Health England that might be good for someone looking for further collaborations with external partners. So, the project was funded by Eastern Arc, and the aim was to collaborate with the immunization team of Public Health England to develop new tools to collect and evaluate mechanistic evidence. I decided to collaborate with Public Health England and that specific team for different reasons. If I have to be honest, the most important reasons was the fact that I knew the manager working on the immunization team, so it was very helpful to have her contact and to just contact her and say, okay, I would like to work with you if possible to develop new tools. But at the same time, it was also very good to see that the immunization team was working on new programs for childhood vaccinations, and they were following the World Health Organization's guide to tailoring immunization programs, TIP. And that was very good for different reasons, but the most important reason was that even if TIP is not mentioning mechanisms, causal mechanisms, there is a big discussion about the social determinants of health and how you can understand whether a particular program, vaccination program, is working in a specific community, and how to collect evidence to understand whether the program is working. And there were also discussions about assessing the immunization situation considering a specific society, and how to understand whether the subpopulation you were considering was the right one, and how to understand the problem. So there were a lot of discussions about mechanistic understanding, even if the term mechanism was not there. So I started from TIP to understand how to develop new tools to collect and evaluate evidence of mechanisms. And during the first meeting, I asked them what kind of tools they needed, considering that they had TIP, so they had a guide about how to collect and evaluate evidence. And they explained to me that one of the most important problems was the fact that they had a lot of programs at the local level, but they were not able to collect evidence at the local level, and they were not able to compare different programs. Not just because it was impossible to do it, but because they didn't have sufficient tools to collect evidence at the local level and to compare them. So they collected a lot of qualitative evidence, and then it was difficult to understand whether two programs could be compared or not. So they asked me to work on possible tools to collect new evidence at the local level, and also to understand how to compare programs at the local level. During the first meeting, I tried to explain what I was considering as a mechanistic evidence, but it wasn't so easy to discuss philosophical ideas with people who were not talking about mechanistic evidence and difference-making evidence before. So at the beginning, there was a problem of translating particular philosophical ideas and methodological considerations into a different language, that is the public policy language. So I had to understand how to develop a proposal that was good for them and also good for me, in order to understand how to work on philosophical ideas and how to translate my work into possible tools and guidelines for a public health team. And when I proposed my tools, I decided to use this kind of discussion to convince them that it was very important to collect evidence of mechanisms. So I considered that there are a lot of barriers to vaccination, and this is what TIP discussed. So you've got a lot of barriers because you might have people acting in particular ways, but also because of belief factors, and there is also, there might be problems linked to a particular society or particular subpopulations. So you know that it's a very complex situation, you've got a lot of factors. And you have to develop something, a particular program that can work in a specific context. And you have to understand whether the program can work in that specific context. And of course, you can collect evidence, statistical evidence, difference-making evidence. You can also have randomized control trials. But sometimes saying that you've got a program and the program made a difference is not sufficient, especially if you're at the local level, because then you want maybe to use the same program in another area and you don't know whether you can do it. So if you consider that the situation is very complex, that you want to understand why a particular program is working in a particular local area, then you have to take into account also other evidence, not statistical evidence, but evidence of causal mechanisms. And of course, I had to explain what a mechanism is. Now, at the beginning, I tried to explain what a mechanism is, considering all the different discussions we have in philosophy. We've got a lot of different definitions of causal mechanisms. But it was very difficult to translate and to propose a sort of example showing why we have different entities and factors working together. So I proposed a very, very simple definition of mechanism, according to which a causal mechanism is made of organized factors that together can lead to the phenomenon under study. So why this is so easy? Well, because if you consider complex situations about vaccination programs, you've got a lot of different levels. You've got individuals making decisions, but you've got also some influence from a particular society. You might have communities having a particular impact in a specific situation. So you've got factors at different levels, and at the same time, they might interact together. There is a sort of organization. A lot of time it's not so organized. It's just an interaction of different factors. But the important idea is that you've got different elements that are working together, and this is why you've got complex situations, and you want to understand the situation in order to develop a good program, a good vaccination program. So I started developing different tools, and there are some tools, some copies of the tools also around, and also some examples to show you more or less what I did. I started considering a particular tool to assess vaccination-related problems, and then I developed some tools about developing new programs considering the particular situation you are studying. And then, of course, you have to design really a new program, vaccination program. You have to think about how to monitor a particular program, and you have to collect evidence in order to do it. And finally, you have really to say whether the program is working or not. I developed different tools because when I started the discussion with them, I had in mind 3 different tools, but actually it wasn't clear how to use them, whether they had to use the tool at the beginning, when they had to assess the situation, or when they wanted to create a new program. So I prefer just to distinguish between the different moments and to provide very simple tools. Sometimes they are more or less the same tools, and to explain how to use them at during the different steps. So the first step is the first tool is just to assess the situation. When you've got a problem related to vaccination in general, you've got one of these problems. You've got no vaccination, not up to date, people with immunization. You've got people skipping vaccination appointments, or people making anti-vaccination propaganda. These are just some examples, are the same examples proposed in TIP, so I started with them, and I proposed others in order to make sure that they could just decide what kind of problems they had. At the beginning, the phenomenon were just on the bottom of the page, so I started considering the different causal factors leading to a particular phenomenon. But discussing with public health managers, they said, well, in general, when we start this discussion, we start considering a particular problem. And then we can think about the different factors influencing that particular problem. So it might be good to have just at the beginning of the page the problem, and then we can discuss the different parts that might influence it. So I distinguish between different factors. This is not my idea, actually. You've got very similar distinction also in TIP, but they are not explained so well. So you just have a discussion between belief factors and behavioral factors. I try to provide a sort of list of different factors that can be important if you consider vaccination, such as beliefs about the aims of vaccination or the risk of vaccination, if in general or for combined vaccines, for instance. And also perception of risk of diseases. So is it important to have this particular vaccination because the disease is really present in our society and we should do something or not? but also the level of trust, for instance, in scientific research or in the healthcare system in general. You've got the same tools also around, so you can look for different factors. But the main idea is that I wanted to provide a sort of list of possible situations concerning belief and behavioral factors. In the same tool, this is still belief and behavioral factors, I also distinguish between personal determinants, external determinants, and environmental determinants. So you might have personal determinants such as personal experiences or particular religious beliefs, but you might also have external determinants such as linguistic barriers, so people don't understand what you're talking about because they are not native English, for instance, and they don't understand really the information you can provide, or there is some information provided by mass media that can influence the idea about vaccination. Or there may be also environmental determinants such as access to vaccination, a particular place. Maybe you are located in a place where it's very difficult to get access to vaccination, especially if you have got a big family, or availability of vaccination, such as the time. If you are a mom, you're working and you have to get vaccination for your children, you need to have time to do it. And the cost of transport or services or other factors that might influence, and that are just environmental determinants. They are not really linked to a particular person. So with the first tool, I just wanted people to think about the particular situation. So for instance, you might have a problem linked to making anti-vaccination propaganda, and you want to understand why. And you can just try to understand whether some of these factors are linked to the problem you are considering. Now, this is just to have a very broad idea of what is happening, and this might be linked to particular evidence you have or particular hypotheses. In my tool, I just say, okay, if you have different evidence, and at the same time, you might have some factors that are not linked to evidence, but that are hypothesized according to what you know about the situation, you should distinguish between some factors, evidence-based, and other factors linked to particular hypotheses you have. Once you have more or less a description of the situation, you move to the second tool to identify possible factors to intervene and change the situation. This is exactly the same tool of the first tool, but I just use colors to represent some nodes that can be changed, some nodes that cannot be changed but that can be balanced using other strategies, and of course some nodes that are the aims of the program. So of course you just want to change the phenomenon, so you want to arrive to a different situation, and you might change these particular belief factors. So you can intervene to change belief factors such as the level of trust people have in healthcare system. But at the same time, you might also try to balance information provided by, blogs and mass media. And in that way, you cannot stop information, you cannot control on the information, but you can try to balance the information you have, you can try to use different channels to provide information. And at the same time, you cannot change what people think about a particular vaccination, for instance, but you can try to engage more with other communities and with particular persons you know that can influence the situation, can influence people's belief. Now, after having identified the factors influencing a particular phenomenon and having distinguished between those factors that can be changed with our new program, you have to identify possible activities linked to those factors. And the first way to do it is just to meet in a room and have a sort of brainstorming, thinking about possible activities. And I realized that this is something that they do a lot of times when they have to imagine new programs, new vaccination programs. So in this way, I just distinguish between the different factors, personal determinants, external determinants, environmental determinants, belief factors, behavioral factors, to think about possible activities that can somehow change the situation, can change particular nodes that are in your tools, of course. And then you have to design. Once you've got a lot of ideas, you have to understand how to design a particular intervention. And this is, again, the same tools plus the intervention. I just gave a number to all the different nodes. Of course, if you just consider 3 nodes, then you've got the first 3, and you just have to think about intervention about the first 3 nodes. But the idea is that you should be able to think about the activities you had in mind and to say, okay, this activity is going to change 1 and 2, or just 1. Is it possible sometimes to have, it's possible to have some activities influencing a lot of nodes, and it's possible to have some activities that are not directly influencing a particular node. But in general, the aim is just to change the phenomenon. So you want to change the particular mechanism linking all the different nodes, and you want to do it by 2 different activities. So you think about possible interventions, and you think about the link between interventions and some factors, the same from personal, external, and environmental determinants. And once you do it, you can think about how to collect evidence of your program. So as I said, one of the problems they had is just about how to collect information about local programs. So they have got very nice ideas. They maybe have also an idea of how the particular program should change the situation. They think about particular factors such as belief factors. They provide you information through Facebook in order to change belief factors. But then they have to understand whether the program is working and how the program is working. And this sometimes is very difficult for them, especially if they are working on a lot of different programs at the local level. So I thought that it was a good idea just to provide a tool to help them think about their programs and do it in a way that can be comparable. So if you use these tools with a lot of different programs at the local level, then you should be able at the end to compare the different programs and to understand what you're thinking about, what you're working on. And at the same time, some of these questions are very easy, such as how can the program be described in general, and where is the program implemented? They are quite straightforward. But at the same time, you've got questions such as what are the objectives, what are the key steps to achieve your objectives. And these questions sometimes can be, these considerations can be very implicit at the beginning. So you think about a particular goal, you think, well, I've got this activity will help me to achieve my goal, but maybe you're not thinking about the key steps you have to obtain in order to have your particular activity to achieve your goal. And at the same time, I also added some questions such as, why might the program not work? Just to consider possible problems you have. And this might be very helpful if you're thinking about local programs again, because some of the difficulties may be just about the local situation, and it would be good to have a sort of description of the challenges you have to face in order to have a successful program. And then methodological questions such as, how does the program population differ from target population? What are the key qualitative data that will be collected during the program? What are the key quantitative data that will be collected during the program? Now, I added these questions because I had a very nice discussion with one of the managers of Public Health England, and they explained to me that a lot of time they have got very nice qualitative programs when they collect information that cannot be really linked to the program they want to conduct. So for instance, they want to change parental attitude toward vaccinations, and they are considering questions such as, did you like the program? Did you like the vaccination program in your school? This is a very nice question, but it's not really linked to the parental attitude towards vaccination. You cannot understand whether you are changing something or not. So it's very helpful to think about what kind of data you want to collect and how to collect them before starting the study, rather than later when you've got the data you have to decide how to use them. And then I added a tool to assess the use of the data. This tool is quite complicated because you should use the tool every time you've got a node. So for instance, in this case, if you consider the first 3 nodes and you have to understand what kind of data you collect, you should use this tool per each node, so 3 times. And you start saying what kind of node you are considering. So for instance, you may say, well, I'm considering beliefs about aims of vaccination, and then you have to answer all the different questions. Why is it helpful to measure the node? Because it's part of the kind of mechanism you have, so you think this is influencing your particular phenomenon, or because you think that it might be part of the mechanism, so you don't have sufficient evidence to say, well, this is really part of the problem, but you are hypothesizing that there is an activity made, a particular influence made by this particular node, or because it is the target of the implemented program. So a lot of time they want to work on co-benefits. So they start with a particular problem, they develop a particular program, but they want to find a way to use the program to obtain a lot of different goals. Not just to change the situation about vaccination, for instance, but at the same time to provide information about something else. So they might decide to collect particular data about a node, not just because it's part of the mechanism leading to the problem, but because it's a co-benefit. And at the same time, it may happen that it is not thought to be part of the mechanism causing the phenomenon, and it's not the target of the implemented program, but the program might change the particular node. So for instance, if you're working on a particular factor, a particular node that you know is part of the mechanism, and this particular node is going to change something here because there is an interaction. Maybe this particular node wasn't part of the mechanism at the beginning, but you are changing it because of your program. So it might be good to have it in your data. And then what kind of procedure you use to measure it. So whether you are using quantitative, qualitative methods, mixed methods, and what are the relations between that particular, I call it marker because of my philosophical work, but actually can be also considered a particular evidence, and the other evidence of the mechanism, and what is the relation between the particular evidence and the target phenomenon. It's possible to have bias. So whether you are measuring something and you know that might be methodological problems associated with measuring that particular factor. This is just thought to be a sort of tool to help them think about their study. So if you think about your program, you want to collect evidence of your program, you want to understand whether the program is working, it's very good to imagine possible situations where you've got problems, or to understand whether you're measuring a particular factor because you think it's part of the mechanism, or just because you've got data and it's good to have also that information. Now, the last tool is about understanding whether the program is working or not. And again, you've got different questions, and the aim is to have a sort of full image of what you did. So the kind of data you collected, what kind of evidence you obtained, and whether it's possible to establish that the program worked or not. So the first question is about how many factors are involved in the mechanism leading to, well, I use constituting your program, probably I should change it, leading, well, constituting your program is the program, not the phenomenon, okay, leading to a particular aim. And of course you have to think about the other tools to count the different nodes you selected, and then you have to understand how many factors you considered as responsible of the phenomenon you want to change. And then how many markers, how many of these factors are measured through particular markers. So again, if you've got this situation, you've got just 3 different factors you want to consider, and you don't know how to consider, how to measure perception of risk of diseases, you're just measuring these other 2 factors. This is very important because a lot of time, especially with belief factors, it's very difficult to measure them properly. So people in some of the programs I considered just avoided doing it. They didn't consider belief factors. They said, well, they might be relevant, but we didn't measure it. We measure something with qualitative studies, but this is not sufficient to say that we have enough evidence to say that this belief factors is relevant for the study we are conducting. And even if these kind of discussions can be found a lot of time in publications, I think it's very important also to discuss them when you're thinking about a program and you want to understand whether the program is working or not. Because as I said at the beginning, the situation can be very complex. You've got a lot of different elements working together. And if some of the factors are not measured, then it's very difficult to understand whether they are responsible for something you cannot understand. So the aim is to have all the factors that are presented in the tools measured through markers. So you should be able to say, well, there are 10 nodes, 10 factors that I've got in my tools, and I've got 10 measurements that can be helpful in order to understand how to evaluate the factors. But at the same time, another question is why, if there is a case where you don't have all the factors, you were not able to measure those factors. Sometimes it's impossible to collect data. So for instance, if you don't have time to have a qualitative study, for instance, you might not be able to collect belief factors and to collect measurements of belief factors, and therefore you don't have particular factors in your tools. But there might also be a problem with bias. So for instance, you have some measurements, but you know that they are likely to be biased, so you don't know whether to use them or not, and you have to decide it. Or it is not clear how to measure something, especially with belief factors. Sometimes asking the question directly is not really working. If you think about asking someone, do you think a particular disease is important in our society or not? Well, this is not a good way to understand whether they are scared about a particular disease, or whether they think that vaccination against a particular disease is working or not, or they should be vaccinated. Some of these questions can be very also difficult to answer because of other factors, such as again, religious factors, community level factors, such as influence between peers. So it's very important to take into account all these different elements when you want to understand how to measure particular factors. And of course, if there are some measurements that are measured and you think that they are not part of the particular mechanism you are considering, it's important to say it. This is important not just because you're measuring it, but because then if you want to compare different programs at the local level, it's very important to understand better from the beginning that some factors are involved in your mechanism and other factors maybe are just the effects of your program. It happened, there was a case where there were two different programs, they wanted to compare them, and it wasn't clear whether some behavioral factors were considered as part of the mechanism or not. They are not talking about mechanisms, they are not talking about particular influence of some behavioral factors, but they are measuring it. So it's very important to think about how to present your particular program and your evaluation also to other people. And these kind of questions can help to clarify some of the assumptions that according to you are just clear and you know what you're doing, but maybe to other people they are not very clear, and it's very difficult to compare then different programs. And again, if yes, why they are measured. Now, this was more or less what I did for the immunization team. And it was very nice, but also very difficult at the beginning because I didn't know how to start. There was a very good tip guide discussing all these possible factors, and there was AVM Plus helping me at the same time. But this is a very different situation because you don't want to establish a causal relationship between a particular exposure and a particular effect, health effect. You want to measure whether a program is working, and you've got the social world there. And this can complex a bit the situation, especially because you are talking about different areas in England, and you've got a lot of different contextual factors that you should take into account. And I'm not an expert on that, so I have to understand how to help people who are doing this kind of works, and they are doing it without thinking about the challenges they have at the beginning. So it was a bit difficult at the beginning to understand how to communicate. I think translating my ideas into their language and helping them understand my proposal and clarify their problems was the main challenge at the beginning. It took, I think, 2 meetings to do it. After the second meetings, when I thought that everything was clear, one manager from Public Health England told me, okay, but I still don't think, I'm still not sure about the word mechanism. What kind of mechanism you're considering? And I was like, okay, I can repeat again. So, at the same time, it was very difficult to meet them in person, so I had 3 meetings in total, and it was very difficult to get their attention. I think they are very busy. They are doing a lot of different works, and I'm just collaborating with them. So it's good for them to have someone working on their challenges and helping them, but at the same time, they have got their tasks. And this is something they can do in the free time. So I'm still waiting for the feedback from